The Senate now has before it for final consideration Senate Bill number 1393. The Secretary will read the bill.
In the Senate, Senate Bill 1393 by Finance Committee, an act relating to the appropriation to the Department of Health and Welfare for fiscal year 2020, appropriating additional monies.
Madam President.
Senator Agenbrod.
Thank you, Madam President. I ask unanimous consent that further reading of Senate Bill 1393 be dispensed with, and the journal show that it's been read the third time at length, section by section, and placed before the Senate for final consideration.
You've heard the unanimous consent request. Is there an objection? Hearing none, it is so ordered, and Senator Agenbrod is recognized to open debate.
Thank you, Madam President. This is the fiscal year 2020 supplemental appropriation bill for the Department of Health and Welfare for the Division of Medicaid Division and the Public Health Services Divisions. For Medicaid, the bill provides $476,600 for an accountant contract that was rebid and approved in August of 2019. The accountant provides support to the division with calculations for hospital reimbursements, provider rate increases, and more. The contract was increased for the first time in 5 years to account for increased costs of work and added responsibilities. Number two, the bill also approves $36,726,200 for Medicaid bills that were held at the end of fiscal year 19 and paid with the appropriation for fiscal year 2020, and adds $16,628,600 to account for the forecasted shortfall in the current year for estimated claims, which is being added to avoid another year of held payments. Number three, finally for Medicaid, the bill adds $16 million in federal funds to connect providers to the Idaho Health Data Exchange, implement software to allow certain healthcare professionals access to prescription information, training for prescribers, and funding for the Board of Pharmacy and the Prescription Drug Monitoring Program. The funding is intended to incentivize providers to connect to the Idaho Health Data Exchange, maintain electronic medical records, and for healthcare professionals to review the medical records and input accordingly, especially with prescriptions for opioids in compliance with the 2018 Federal Support Act. For the Physical Health Services Program, the bill provides $15,000 to support the collection of data related to Alzheimer's and related dementia diseases. The data is part of the behavioral risk factor surveillance system, which reports and is used by the state to better understand the incidence and effects of the disease on Idahoans. This will lead to better treatment and service options for those living with the disease and to provide better support options for individuals that are caring for Idahoans living with the disease. The total general funds appropriations are $18,596,600, dedicated funds of $4,769,000, and federal funds of $46,471,800 for an all funds total of $69,837,400. Madam President, debate is open.
Is there further debate? Senator Groh.
Madam President, would the senator from 13 yield to a question?
Will the senator from District 13 yield to a question from the senator from District 14?
The senator will yield, yes.
Thank you, Senator Groh. State your question.
Thank you, Madam President. My understanding, this has been going on for several years. Could you tell us how many years and how much money has been spent to date on this?
Senator Agenbrod to respond.
Madam President, Senator Groh, I think you're referring to the Health Data Exchange, is that correct?
Oh, yes. Thank you for clarifying.
Yes, the Health Data Exchange originated with federal monies probably about a dozen years ago, and it was a nationwide effort, again, pushed by the federal government to build health data exchanges in each state. So every state was involved in them, and Idaho is one of those.
Thank you, Madam President. And again, a follow-up, if I may.
Will the senator yield further?
Yes, I will.
Senator Groh.
Yes, I asked how much had been spent to date on that.
Senator Agenbrod.
Thank you, Madam President. I don't have that number in front of me, but I would venture to guess that it's probably in excess of $80 million to date. This additional money would bring us up with the Health Data Exchange to a self-sustainability, and we would not require federal funds going forward, and certainly not general funds.
Thank you, Madam President. To debate against the bill, if I may.
The senator has the floor.
Thank you. I appreciate the Senator Agenbrod and the work that he's done on this, and commend him for all the efforts he's made. I don't have any problem, as he pointed out, on the other issues listed there other than the Health Data Exchange for the $16 million. The track record hasn't been that great on this, as it's gone over many, many years, as you heard. A lot of money's been spent. We hear this is federal money. You can see on the statement of purpose that it's federal money, $16 million. Sometimes there's a tendency for some around here to feel that federal money's free. We better take whatever we can. We need to remember that whenever the federal folks give us money, there are also federal controls that come with this. We hear a lot about the need for the federal government to balance the budget. We see these annual deficits of more than $1 trillion a year. And as I've been here this session, I've come to realize even more so that part of the problem in the federal deficit is us at the state level, because here in Idaho, for example, we receive more than $3 billion a year from the feds for health and welfare and education, transportation. And I can imagine what the big states like California and New York might be receiving. So I'm reluctant to have us take the money just because it's free, because I am concerned about balancing the federal budget. Another concern I have, when the feds participate in something like this and have controls, then something gets set up, and then they can mandate we continue to do it, even though they may not be offering any funds in the future. So there may be a need to have some state funds as we look down the line to keep this thing operational. My concern is, to date, over the 12 years or whatever it's been, it has not become a self-sustaining model. I'm concerned this is another government intervention into the healthcare system. And when the government basically nationalized health is what that's moving towards. And I feel that free enterprise, I hate to see free enterprise move to the side. I think that's really where things ought to be. Another concern I have, the $16 million that we're appropriating is for this fiscal year, needs to be spent before the end of the year, so it gives us 3.5 months to spend it. I get concerned when we're rushing to spend money, and I know some of this will be prepaid, et cetera, but I still get concerned when we rush to spend that kind of money in a short time period, just because it's money the feds want to give to us. In my own health situation, I'm with St. Luke's, and I'm in their system. I also use University of Utah Health folks, and they're both on an EPIC system, which is a system that those hospitals carry so that they can talk to each other. I've heard that, yeah, but if you end up in a different hospital, you have an auto accident, you have to go to a different hospital, then they may not have your information available. I'm confident that if need be, they can get that from the other institutions. I look at an auto accident as an exception, and we're talking about tens of millions of dollars over many years. To me, that's an exception versus the rule, and we ought to be looking at the rule and not spending that kind of money on an exception. So I will be voting no on that. Thank you, Madam President.
Is there further debate? Senator Lee.
Thank you, Madam Chairman. To debate in favor of the motion, this has been something that we've looked at for quite some time and tried to wrap our heads around what this means. And as we look at these large budgets that you will see coming through, particularly on health and welfare, for those of us that want to try to get some cost containment and understand how these costs are going in our state, as the good senator from 13 has shared, we're moving to a value-based versus a cost-based. And so in addition to providing these electronic medical records, which will be required by CMS, whether we like what the federal government is doing or not, in order to access Medicaid and Medicare funding, all of our providers will have to have these electronic medical records by fall of 2021. So this is an opportunity in a short period of time and with some large dollars to get to a place of working with our providers to find out what are the barriers. Why are they not accessing these electronic medical records? And this provides funding to bridge those barriers. Is it broadband? Is it other technology portal access? Is it just education? And so we have a responsibility to get people up to speed. If the free market could do it, good senators, I think it would have done it by now. This is not just a hammer from the federal government. This is a requirement for us to be able to get a handle on our costs. This is a system where we will be able to get to see for the first time comprehensively what is happening in our state in healthcare, how many days people are spending in the hospital, what these costs are for our Medicaid budgets. Again, you will see some really large numbers. We are shifting for the first time to a whole different payment scheme. And unlike automobile insurance, this is extremely private information. And so we don't want anyone just to be able to access our health information. So there is a cost to being able to protect this information, and there is a cost to making sure that we have a centralized system. When you look at our different healthcare facilities, if they were to coordinate independently, that starts to have a feeling of antitrust. That starts to have a feeling of these entities setting prices. And so we want to be able to provide some independence with the free market, but also a government interest. Were we not paying these costs with our tax dollars, perhaps we wouldn't be so interested. But we are a significant payer in healthcare costs. And for the first time, this is going to get us to moving to a brand new system of education, of knowledge, and of payment. And with that, good senators, I would urge your support of this, and we will be back here revisiting the benefits and values of this.
Is there further debate? Senator Bayer.
Thank you, Madam President. The ability of providers to be able to communicate and to share records at appropriate times cannot be understated. It is absolutely critical to health care as we move towards the new model of reimbursement in Medicaid. But even more importantly, it'd be wonderful if we all lived in Boise or in some place that had St. Luke's, because then our records would certainly be available. But I live in Blackfoot, and in Blackfoot we have a critical access hospital with limited abilities. It's a 24-bed hospital. If I have something wrong with me, I have to go to Idaho Falls or Pocatello or, heaven forbid, Salt Lake. And those hospitals don't have my records that my provider has. This program that we're talking about, this Data Care Health Registry, is the piece that allows all St. Luke's, St. Al's, Bingham Memorial, every doctor in the state to have access through credentialing to protect our personal information. That is there so that we can do a better job of taking care of our folks in the state of Idaho. As the good senator mentioned, we also will be able to, for the first time, gather generic data about illnesses, what types of illnesses, and how long the hospital stays are, how we can provide better care going forward. Without that information, without that critical data, we don't get to where we need to be to bring down healthcare costs in the state of Idaho. Thank you, Madam President.
Is there further debate? Hearing none, Senator Eggenbrod is recognized to close debate.
Thank you, Madam President, and thank you for the comments from Senators from 20, from 9, and from 31. All good questions. The criticism of the Health Data Exchange over the years has been the financial side, not what it does, but the financial piece of it, and the unsustainability, self-sustainability. This money gets us there. I can assure you that the committee that looked into this, the request was for $24.9 million, which matches the federal government grant that was approved. We went through and said, what can we cut out the bells and whistles? What do we need to get there? And that's where the $16 million comes from. Let me tell you just a little bit about the Health Data Exchange. The Health Data Exchange this year will process 80 million health records in Idaho. So to say that it's not used would probably be inaccurate. Currently, the health data records are on 2 million individuals. Well, how do you get 2 million individuals out of a population of 1.7 million? Well, this means that probably all Idahoans plus other people that have had health care in the state of Idaho over the years have their data in this exchange. there are 9.4 million individual unique medical records. So what this means is each provider, each person that puts, each entity that puts a health data record into the system has a unique code. So to think that we're within a St. Luke's system or a St. Al's system or another system that have all of our health data records is probably not accurate either, in that about on average, there are 4 records from different providers, 4 different providers for every Idahoan, again, on average. We may not attend the clinic. It could be lab results, it could be x-rays, it could be other things that are read elsewhere that are submitted by those entities. Lastly, we have about 6,539 healthcare staff that use the Idaho Health Data Exchange today. What does that mean? That's only about 40% of Idaho's healthcare providers that are using it. The key to making this work and to self-sustainability is to raise that from 40% to hopefully 100%. That's probably not going to happen at 100%, but certainly we can bring more people into using the Health Data Exchange for the benefit of all Idahoans, and that's what this money is for. Madam President, debate is closed.
Debate being closed, the question is, shall Senate Bill number 1393 pass the Senate? The Secretary will call the roll.
Agenbrod, Anthon, Bear, Bayer, Brackett, Buckner-Webb, Burtonshaw, Cheatham, Crabtree, Den Hartog, Grow, Guthrie, Harris, Hyder, Hill, Johnson, Jordan, Blakey, Lee, Lind, Lodge, Martin, Mortimer, Nelson, Nye, Patrick, Rice, Shank, Souza, Stennett, Thane, Fick, Ward King, Winder, Woodward, Anthon, Den Hartog, Mortimer, Thane,
Roll call shows 28 ayes, 6 nays, 1 absent and excused. A majority having voted in the affirmative, Senate Bill number 1393 has passed the Senate. Is there a correction to the title? Hearing none, the title is approved, and Senate Bill 1393 will be transmitted to the House of Representatives.